So welcome everybody. My name's Rob Terry. I work in PDR, which is the special program for disease research and training in tropical diseases. We're hosted by WHO, and I'm really pleased to welcome you to this seminar this afternoon on the ethics of data sharing in health research, obviously within the context of COVID, which will be bringing that in quite a lot. I'm joined today by three panelists, and I will ask them to introduce themselves in a minute. Just some sort of housekeeping. There won't be any presentations in this meeting. We hope you've had a chance to read the background material that was circulated alongside this webinar, and also the excellent report that was produced by the Global Forum on Bioethics and Research from their meeting back in 2018, when people could actually meet with each other. But many of the topics that were raised at that meeting, we're going to be covering again today. So a couple of things. Everybody, in order to make things easy at the moment, the panelists will have open mics, and then we'll have the discussion. As a participant, you will be able to ask questions, but what I'm saying to say is if you can put those in the Q&A function, and then use the chat function for greetings and hellos, but use the Q&A function for questions. Fantastic response from the registration. We have 185 questions registered. I'm not promising we'll get through all of them, but we're going to give it a good go to cover the main themes. So without any further ado, I'm now going to introduce the panelists. So I'm just looking at the way that things are organized on my screen. So Uman John, if you'd just like to unmute yourself, if everyone would like to unmute themselves now, and Uman, if you just introduce yourself briefly, and particularly in relation to this topic, ethics and data sharing. Uman, over to you. You need to unmute yourself, sir.
Yeah, thank you.
Thank you.
Thanks, Rob. It's a pleasure to be here. I'm Uman John. I'm trained as a physician. I currently work as a researcher at the George Institute for Global Health. So primarily my area is interest is in informatics and in data sharing. And I also am secretary of the Asia Pacific Association for Medical Informatics. And through this network, we're trying to encourage data sharing in the context of COVID. Thank you. Pleasure to be here.
Lovely, thank you. So Gloria, would you just like to introduce yourself, please?
I'm Gloria Mason. I'm from Liberia, the director for the National Research Ethics Board, the West African Consortium, and also a member of the Independent Data Access Committee. In 2018, I was part of the planning committee for the Global Forum on Bioethics, and one of the panelists. Thank you.
That's lovely. Thank you, Gloria. And Fia Kyong.
Hi, Peg Yong Chia here. I'm a member of the steering committee of the Global Forum for Bioethics and Research. I'm also head of Bioethics and Engagement at the Mahidol Oxford Tropical Medicine Research Unit based here in Bangkok. I'm also the coordinator of the Moru Data Access Committee, and I led the development of our data sharing policy. I've been interested in and have published empirical work on data sharing for the past few years. Happy to be here.
Thank you. Thank you very much. Okay, great. Well, let's move on to the questions. As I said, we put some questions in the material that was shared in advance, and we have had a whole range of questions in the registration process, and we're now going to try and cover those. So I guess really the starting point on data sharing is, if we're going to do data sharing, what are the benefits? Why should we do this? What are the advantages of sharing data? I'm just going to ask Uman if you maybe just want to kick us off and just say what are the real benefits of being able to share clinical trial and patient data and other things that have that connection with the individual. So Uman, over to you. You need to unmute yourself.
Thank you. So thanks, Rob. So I'll take an example from the context of COVID. So we have seen a number of studies that have come out in, let's say, the role of prophylaxis with hydroxychloroquine. Quite a few of them are underpowered. And so when there is no clear direction from many of these small underpowered studies, one of the main things that you could do is to pool that data to do a meta-analysis. Now, if all of the researchers or investigators are doing something that we call in India as data hugging. So they hug onto their data and hold it dear to their hearts. We will never be able to answer this important clinical question. So I'll start with that in terms of, so if as part of research, we are collecting data, we are doing so to be able to draw some inferences and further evidence around the topic of interest. If we ourselves have not been able to contribute because of whatever reason, we've not been able to recruit enough participants, or we don't have enough power to do that, might as well join hands with other researchers through a data sharing framework that's ethical and with taking into consideration all precautions in place to protect the privacy and the confidentiality of concerned people. If we pool that and are able to draw that inference which was missing before, it would be invaluable. So I want to also share about another example of the work that we are doing in India. So till recently, we never had measurement of outcomes in dialysis, despite the fact that there is a national program. So nobody knows, as if somebody gets onto dialysis, how long do they continue on dialysis. So with support of Indian Council of Medical Research, we've been encouraging dialysis centers to share individual patient data with consent, de-identification, anonymization, all of that in place to look at outcomes. And to our surprise, we found that despite the best of intent, most people do not last more than 6 months on dialysis. So if you don't share data, you will never come to know that. And you can have a large national program running, pumping in a lot of investment, and not really know what the outcomes are. So I would leave it at that. Thanks, Rob.
Okay. So again, I mean, we're answering questions that we couldn't answer in single studies. We're improving the efficiency of the research process, and we're able to look at things, particularly with underrepresented populations, so children perhaps, or pregnant women. So it sounds like there is a lot of benefit there. But of course, with those benefits come potential harm. So Gloria, maybe just briefly outline from the sort of ethical perspective where you think those harms may lie. You need to unmute yourself, Gloria, if you're...
So the issue of data sharing, as Uma said, it is important, but the question remains: are there structure in place to regulate these different data that are being shared, whether from the pandemic or from the hospital? So these are the questions that one will consider or running through the head. Are there structure in place, governance? So I would say, like for my country in Liberia, we do not have a governance structure in place in regulating data sharing and policies, particularly when it comes to local researchers, and whereas they've been pressured by funders to share their data. So the question is, because they are limited in terms of funding, and so they go about being pressured by funders to share these different data. But then if there are governance in place that can put some administrative benchmark in place to be able to regulate both the funder and the researcher to know what are those things that are important in terms of safety, confidentiality, security of the general public or the different community that these research are being conducted, then we would say it is good to share. But the question, if you don't have those policies in place, then where do we go from it? Then that's where the ethical issues comes up. How are these data being shared? Are they being compromised? Are they being slumbered out of the country? What are the policies in place? And I tell you, these are critical issues that we in the low and middle income country, particularly for my country, I know we face. We saw that in the Ebola, during the Ebola outbreak, a lot of data that was generated, and these data, some of them are not being used, some of them are being maybe deposited somewhere that is being maybe regulated. So there are still challenges, particularly for countries that have limited resources, and funders tend to use the means of providing funding, but then in terms getting something afterwards. So I think there are a lot of ethical issues in terms of the regulation that are in place, administrative, policy issues. Those are key that and a question on the safety and of the privacy of these different data that are being collected.
Okay.
So I will stop here for now.
No, that's, I mean, that's excellent. I think there's a couple of things there. One is the role that funders have, and sometimes some of the additional pressure to share data when perhaps the infrastructure or maybe the research capacity or the ethical capacity isn't in place, and there's perhaps a risk that is arising there. So, I mean, that actually leads us on to our next question, actually, which is, you know, what is it that we need to ensure is in place with data sharing policies so that they are respectful and respect the communities where we're obtaining the data? I'm going to ask Young, do you want to just kick us off on that? What do you think needs to be in place so that we're in the correct space?
Thank you, Rob, and thanks, Uman and Gloria, for bringing up these important things. So I think for any policy to be respectful, one of the first and most important things is to get right is the consent mechanism. So for new studies, researchers to obtain consent from participants for sharing their data with others external from the primary research team. So this, you know, is called broad consent, as most of us know, and currently the most widely accepted mechanism to obtain participant consent for sharing data beyond the primary research team. However, you know, we also must be aware about how we communicate broad consent with participants. From our own interviews with our participants, we found that communications about data sharing is really difficult. It adds another layer of complexity to the already difficult consent process. Many do not understand what it means by data sharing. Also, I think to be respectful, we should be aware of potential group harms. And these group harms may apply even when data are anonymized. Groups of people, whether they are identified by geography, disease, or ethnicity, may have concerns of potential harms that could result in, let's say, stigma. Or discriminatory uses. We always forget too that, you know, our data sharing policies tend to look at harms only, or worries about harms only. So data sharing policy should be designed to maximize the use of data for public good. So participants, many of them join studies because they want to do good. They spend time and energy and sometimes take risks to join studies. So maximizing the use of their data for public good is respecting the altruism and commitment of these participants.
Okay. So you mentioned consent there. How feasible is it in all situations that a very clear consent can be identified and used? Is that the same in every situation, do you think?
Is that directed to me, Rob?
It is, yeah. Well, I'll then open it up.
Well, I think it is context specific. When we conducted our research with our healthy participants for a vaccine study, and when we asked them, did you consent for data to be shared? Everyone said yes. And then when we asked them back, what did you understand about it? They didn't really understand about it. And some people thought it was like Facebook. So some people thought it was, you know, sharing everything. So I think it really needs a little bit of contextualizing and to understand the communities well. And that was a Bangkok community. So you can imagine when we go somewhere else, analogies might be different. So yeah.
Okay, so in a sense, consent just by itself isn't really enough of a protection, because people may not understand the consent, and there needs to be other issues, other elements that surround that consent to make the reuse ethical. Gloria, we've done some work together with patient data that was collected during the Ebola outbreak. Right. Do you want to just talk about how other elements of that governance mechanism were put in place in terms of community participation and other things? Yeah.
I think with the data access platform process that is in place, I think it's good because we have We have the applicants also applying, some of them apply to their institutions for an ethical approval. And then they are also submitted to the data access committee, whereas this committee they are from different countries, particularly from the 3 most affected countries. There are members on the committee who are from those countries, and they are on that committee. So it's been reviewed sometimes was like online, but it's question are asked, and then we look at what are the benefits that goes to other of these countries that were most affected, and in terms of training, in terms of working with the locals, maybe or local researchers who are going to partner with you on that project, which is very important because people, if you are using people data, there should be some sort of whether direct or indirect benefit to the community. So if you have a local researcher or training need or capacity building that will impart the people in that country, I think is important. And to the point of with the consent process, one of the things that's where the ethics committee comes in. The ethics committee plays a huge role when it comes to data sharing, how it's being shared, and the process of consent. So the ethics committee should be able to put some method in place, some policy in place that because the ethics committee are the face of safeguarding their people, then they should be able to ask those difficult questions to the researcher that what are some of the policies in place? Okay, if you are collecting this data, are they going to understand the informed consent? Are you going to give a blanket consent, or what process are you going to put in place? So I think it is key that the ethics committee play that critical role before even the research is out into the community. I think it's important.
Okay, so I think one of the things you've made clear there is that really the use of the research data, and it needs to have a relevance for the population from where that data has come from, and that population needs to be engaged in creating that kind of research agenda. I'm wondering, Uman, you're a researcher that's very much engaged in using these data. From your perspective, what do you think needs to be in place so that you can reuse data in a kind of ethical and efficient manner? You'll need to take your mic off. Yeah, yeah, you're still muted.
Yeah, no, yeah, there's some technical issue with it. Yeah,
no worries.
So yes, Rob, I'll give you an example of this. So we working with a government in India, in the state of Andhra Pradesh. So there is a high kidney disease burden district, and young people were dying, and for this has been going on for about 10-15 years. And what had happened before the government announced the Grand Challenges program was that different researchers were going into the community, doing small studies, collecting a lot of samples, and just disappearing. So this has happened over 5-7 years. And so when we went there for this project, they were told that, see, if it is to collect samples and go your way, absolutely not. What we realized is that you need to take community consent, because that community was already severely suspicious of research. It was suspicious about what researchers' intents are and what is going to happen to their samples and their data. So initial 6 months of the project, we just worked with the community to understand what their primarily concerns were. And then the first thing that we did is that as soon as any result was available from a test, we went back to the community, home by home. We gave them back the reports and build confidence of that. So now, because of that, the community consenting as well as the other part, like investigators from the locality, all know that the intent of the research is to actually benefit the communities, and they are visibly seeing that change happen. So they have seen that in the primary healthcare centers, facilities for kidney disease patients have come up because they were able to document that there is so much of burden of kidney disease. So when they are able to perceive benefit, then it is much more easy to use data as well as share data. Even researchers are much more keen to be part of that. So.
No, I think these are excellent points. So we've heard about individual consent, but I think what you brought in there is the concept of sort of community consent, community engagement, and the role there for researchers to do that and feeding back their findings, and so that there is that sort of trust relationship is not only established but maintained through that kind of feedback process. So I think that's great. Phiet Yong, in your perspective, as we are now under this pandemic and everybody is trying to move as fast as possible, do you think there are elements of the current system that might need to change, that we could perhaps, I don't like to use the word short circuit, but maybe cut through some of the steps because of the sense of emergency that we're now under?
Ooh, this is a tough one, Rob.
Yeah.
It's a tough one because I think the safeguards should still be in place. We, like everything that happens in COVID, everything that is going that one direction is just going faster. So I think we would like to promote. I mean, I'm all for promoting the sharing of data as much as possible. And with COVID, it just, we just need to give it a little bit of a push to do it more quickly and more efficiently. I mean, what would be really good is for everyone who's conducting research, whether or not it's for an emergency or not, is to plan a study with data sharing in mind. So it should be planned, designed from the start. So with COVID, I think we're going to get a little kick in our behinds to do that more quickly than usual. But we are going towards like that direction, albeit very, very slowly. So I hope that we can go faster, and that data sharing should be a default rather than an exception. And I'm saying that I don't mean at all open access. I mean data sharing with safeguards in place should be a default, and it should be planned from day one.
Great. Yeah, and I think actually one of the things you brought up there is that in order to enable data sharing, we have to prepare right at the beginning when the research protocol is agreed. And ideally, if we could follow the same protocols, the sharing of the data would be so much quicker because the data would all be harmonized and using the same sort of standards, I guess. That would be a massive step. And I know, if I just think of an example, we had in TDR, we had 4 TB studies looking at exactly the same drugs and trying to shorten the TB treatment regime. It still took many, many months, even though they were observing the same protocols, to get those data aligned so that even from a technical perspective, we could actually, as Uman was saying, bring those data together and look at them as a whole rather than as 4 separate studies. Gloria, I'm going to come back to you. And again, maybe it's a little bit of a repeat question, but I think it's probably quite good. In terms of, from your perspective, what do you think are the key features of a governance framework? So these are all the elements that come together in order to share patient data. And are some of those features more necessary or more distinct during a public health emergency?
So I will start back. So lesson learned from the EVP and now with the COVID pandemic. I think
the EVP is the Ebola data platform, just in case everybody's not up to speed.
Yes, yeah, the Ebola data platform. So lesson learned is there was no policy in place in terms of data sharing. From my own perspective, from my country, there hasn't been any policy or some framework in place when it comes to the sharing of data, like maybe the health data. So maybe some institutions, other countries, if some of them have the clinical ethics committee and maybe system in place, but for ours, my country, we do not have. But from the Ministry of Health with this COVID-19, I think there has been some system in place, which is the incident management system, where all of this data is being deposited, and then you have through the Ministry of Health, where they do their approval, and then it comes down to the ethics committee. The ethics committee do the approval of this data before it's been research is being conducted. So I think lesson learned from the Ebola is have come to the COVID. We have put some system in place. So I think there has been a lot of the issue of structural governance framework, lack of the framework to be able to address these issues when it comes to data sharing and policies that will help to benefit not only maybe individual but the community. So I think there is a need for a framework that will be able to address the structural issue, payments issue in terms of research, and the issue of training, because a lot of times people are not educated to these things of what to do and what not to do. So I think the issue of training is key when it comes to data sharing.
Okay, that's good. That's a really good point. So in terms of building capacity within the researchers, within clinical people, and I guess also within those that are managing and curating data. Would that be right?
What was the question?
Well, no, I was just reflecting on what you said about training being important and supporting capacity both within researchers, but within ethics review committees, and also within those that curate and manage data, building capacity to sort of manage those data within that governance framework that you were setting out. And I'm going to ask a question to Oomen as somebody who uses these data. Oomen, people often get very nervous. They're saying, well, you know, all of my data will be out there, my identifier, my address, every detail about me will be. When we talk about the reuse of data, what sort of protections are around it? How much anonymization is anonymous or encryption? What data do you need in order to answer the sort of research questions that you're approaching?
So ideally, it's at different levels, Rob. So it depends on your research question. So when you want to look at very, very specific aspects, you would need individual patient data from clinical trials. So that makes the best thing. But if you were wanting to look at trends, or if you want to, like, I'll take an example of influenza vaccines. Okay, now, not from a perspective of just trials, but from, like, if you were to have a vaccine that is going to be relevant for a particular seasonal flu, you would need to know what strains are circulating. If all the countries which are participating in this do not share that aggregate data from their countries, we will never get the right kind of vaccines in place. That's one. But if you were to look at, let's say we want to look at disease trends or what specific interventions might be useful for models, for example, let's say there is a burden of a particular kind of illness. And I would take the example of antimicrobial resistance. This is a very, very good area to look at. So there you don't need all the details of the patient, right? You just need that you grew E. coli and the E. coli was sensitive or not sensitive to a certain range of. So if you're able to pool all E. coli from a particular hospital and then from a district and then from a state, you know what are the circulating strains. So if you were to look at the antimicrobiogram or what would be antimicrobial policy for that particular state, then this data is going to inform you that. So it's at different levels of what level of granularity you need in the data versus how to go about it.
Yeah, no, that's great. So Phiek Yong, how do you address this issue in terms of protecting people's privacy? How is that actually handled? I mean, how do we do that?
So I'm not a data manager, so
No.
But I know our team of data managers, when they get a data set, they will de-identify the data set, and there are certain things that they do which I can't fully explain, but the data set will be de-identified to an extent that you can't identify as the individual. But the process is quite well, I wouldn't say it's laborious, but you know, there are certain steps that they have to take. And in addition to the identification of individual characteristics, so these are addresses or personal identifiers such as a telephone number and things like that. But we also have to be aware of things that are not that obvious. So if you're the only physician in the village, everybody is going to know it's you. So we have to be careful about these type of characteristics as well. And then typically when, you know, we share quite a lot of our data with third parties, and typically we have our legal team to draw up an agreement with the receiving party. And in the agreement, it is stated clearly that they are not allowed to try and identify the subjects, and among other things, like, you know, this is your objective, you keep to it, and other good practices. But it is a code or it is signed in an agreement. They're not allowed to try and identify people. And also they can't send it on to a third party or try and combine it with other data sets to identify people. I mean, if you have a data set from, let's say, a hospital, and you combine it with another data set, I don't know, phone data sets or other things, if you combine these two, you might be able to find everything. So in the agreement, it is stated clearly they're not allowed to do that. I mean, if they do, and we find out, the agreement is in place between the two institutions. Obviously, hopefully it doesn't come to that, because most researchers will not do that. But it is there in place in an agreement as safeguard.
Okay, so Gloria, if we have data that's been brought together on a platform from many different areas, who should be allowed to access that data, and what is the governance mechanism in place that ensures that they're the right people to use the data and they're going to use it in the right way?
I think basically, as I said earlier today, if there are maybe frameworks in place to address these concerns, then you have a system in place to maybe if someone wants to access that data, maybe if it's stored, I would say maybe at maybe UK or whatever it is, whoever is the researcher want to access the data will apply to the governing body, and then they can now go through the process. Once approved, and then they can send a request to whatever institution that has the data and be able to access the data. But again, both, I would say if we have a local, who should access the data? Is it the local researcher? Is it the country? But I think the country themselves have the right to access their data at whatever time they want. They should, but there should be a system in place. Not that anybody or anyone just coming to say, "Oh yes, I want to have access." There should be. So whether it's a Ministry of Health that supersedes that, should be able to put some system in place that it go through whoever is whoever stores those data should have those documents in place, whether legal or some ethical process in place, so that people cannot be used out there. So I think it all boils down to policy issues, structural issues, issue of training, issue of disease prevention, and all of that. So all of those policies are in place. You will have a system in place to be able to access the data, identify who's going to access the data and what have you. So I think one of the issues we face in, I would say, in Africa, Senegal has a good system in place, and Sierra Leone is trying since the EVP. So I think Liberia is in that first step, but we're still having these challenges in terms of setting up a clear framework of guidelines that would allow local researchers to be able to access those data. But I think it's still a challenge for us, and hope that we can, with our funders, can work together with countries that do not have those systems in place that can identify our limitations and be able to work along with the locals in that country to be able to put policies in place. Other than that, a lot of these data will just sit in the repository, and it will stay there for years because there is no policy in place. So people are afraid to even go after this data because you don't want to get any problem at the end of the day when you publish a paper or you do a research. But again, it boils down to policy issues, structural issues, and hopefully the government as a whole has the obligation to be able to put these policies in place.
Okay, no, that's great. And I think in a way, what we're really saying is that when we talk about data sharing, this is a managed process. It's not something that's just free and out there and your data is available for anybody to use. There is a process of applying. There is a data transfer agreement in place, which has certain obligations on the researcher. And also there is usually some kind of gatekeeper, like a data committee, in order to control access and who's using this and those types of things. So I think we're sort of developing that framework, or at least we're putting it forward again today. It's more than just one element that needs to be in place. I think one of the sort of last general questions that we had in advance, and then we'll go on to the ones that are being raised in the Q&A function. And also, as I said before, we had 185 questions in the registration. So this is a question to all of you, and I'm going to go to Uman first, and then we'll go around. So In the current system, we obviously have consent, either an actual consent or an implied consent that's from say, maybe a community-based network. We have a governance system, which means there is a data access committee. We have data transfer agreements in place. We are in a situation right now where we need to move as fast as possible, but not to create any more risks. And I'm just wondering, Uman, if from your perspective, are there things right now that need to change? Are there any policies that need to be changed, or are there any steps in the governance arrangement that could do with being revised in order to enable us to move forward quicker, but without actually compromising the ethics of the people who are involved?
So, Rob, it's a very tricky question because it has to be addressed diplomatically, because when it comes to cross-border data sharing, there are governance mechanisms of the law of the land, because you can, as much as you can do get benefit, there's also unintended harm that could be. And in the context of COVID, one of the things that many governments are worried about is that would it, if for example, the data from studies or from epidemiological data is available for, let's say, platforms, and people do models and predict that you're going to hit into a huge crisis in terms of your healthcare facility capacity, and that could create panic. So, it's kind of a double-edged sword in terms of the governance mechanism. So people tend to be risk averse, so they don't want to do no harm at all. So let's not have any benefit as well. So so one needs to see what is the harm and balance it against what is the intended benefit that could come out of it. So like, for example, one simple example that I would say is that almost all countries have introduced some form of contact tracing and response. So let's imagine if all the countries were able to pool what mechanisms worked best, how were they able to use that, actually backed by data, and this data was available cross borders. Other countries could learn from what has been used. So shouldn't we not have mechanisms by which that kind of data is available? So let's go back to even the research kind of data. So even for that, many ethics committees or regulatory bodies are averse to that data going out. So if they feel that as long as the data is within the constraints of their geographies and within the constraints of their buildings or servers, it's safe. It's never safe in that sense. So anybody can hack in and do it. You might as well put in place good mechanisms by which that can be made available as a public good, in terms of not a public good for anybody to use, but like we mentioned, that it is clearly defined as to who can use that data. It should be people with track record of actually using data for research purposes and deriving evidences from that.
So you're sort of saying we need better international agreements on how we can share data across borders, and that would certainly be very helpful in the current situation.
And also some education to the ethics committees that data hugging may not be the best thing to do.
Data hugging again. Fyeg-Yong, from your perspective, what would you like to see a change, or what change would you like to see? And particularly in relation to, say, what COVID-19 is really stressing the system. So
yeah, so you know, we've been talking about data sharing for ages now, and if I ask the attendees, for example, how many of you within your own department or institution or even your research group have a data sharing policy? We should all, group small or big or at some level, have our own policy. So institutions or departments or groups need to set up your own data sharing policy, and within that policy, specify your aims and the data request procedures for the data set that you are looking after for you generate. And then you can set your aims, and the aims should be consistent with the aims of your group or your institution. For example, if an institution or department, their aim is to eliminate malaria, then data generation and data request and data secondary use should go towards the aim as well. If the institution is to strengthen research capacity, the policy should do likewise. And this alignment will help researchers maximize the usage of their own data from both primary and secondary analysis. So this is an internal motivation. I mean, this I have to address this ultimately, right? What is an internal motivation for a group? We have to address that. And these policies will provide a framework for all data sharing decisions within the group. For instance, which secondary use to support or to prioritize. They could also help in evaluating the impact of data sharing, and to have any evaluation criteria. If you go back to the example of, let's say the institution is to help capacity building, then you would have capacity building indicators. So I think we should start from an internal motivation. So a data sharing policy will also strengthen the position of the institution when applying for funding, when submitting research papers for publication, and also when requests for data from other people for secondary analysis. That's my thing.
Yeah.
Everybody should have a data sharing policy.
No, that's great. I mean, I think what you've really said there is that in order to move faster within an emergency, it's about preparation. We need to be better prepared. And one of those things is actually having a data sharing or a data management policy in place in advance. It's very, very hard to build the ship as we're sailing, as it were. Gloria, I'm going to ask you, I mean, you're tremendously involved in this experience. We worked together on establishing the Ebola data platform and working across those 3 countries that were affected there in West Africa. And let's face it, it took nearly 3 years to put in place a governance mechanism that everyone was happy with. What, from your experience with that, what would you like to see that would change, or how would you want to see things done perhaps more efficiently or faster in the future?
I think for the 3 most affected countries, we are not making use of our own data.
Yeah.
Yes. We are not applying. So the question is it because we don't have the capacity? Is it because we don't have the funding? Is it because we are not informed? How many? I think one of the, I mean, even with the data platform, and I hope maybe the day we meet is one of the things is to do public awareness. I think it's important. I think we're lacking that, and because not many persons inform, even know about the data platform or how is it been operating. How do people even access the data? So I mean, I was talking to a colleague of mine this morning. He was asking me, how do people apply for access to data? So that is the challenge that we are having. People are not informed. Even with the young researchers in Liberia and other countries, they are not informed. So we are not making use of our own data. The data is available. How to go about it? I mean, that's the process, the whole process. But our young researchers from the universities, from the research institution, are they informed? Are they trained enough to do a little research or whatever? So how can mentors or people who have done research over the years be able to build a capacity of young researchers to get involved into accessing their own data? So our data is sitting there, but we do not have the education to access them. So I think there's a need that both the Data Access Committee and whatever institution may be listening on this call, there's a need that we first do more community awareness, whether it be a country or what, where awareness is lacking, and there's a need for training, there's a need for funding to be able to impart young researchers who want to aspire to further access the research. To be able to, I think this will inform disease prevention. It will help to build the capacity of this country.
Okay, so again, it's around capacity building and training. So I'm wondering, Oomen, from your experience, what sort of training is available out there? What sort of training do you think is needed in order to enable researchers, particularly from low and middle income countries, to really get engaged with data sharing?
So there are attempts, Rob. So like Indian Council of Medical Research in India has been quite active, and I think Dr. one of the persons who was leading that whole effort is on this call as well. So they've been doing a series of workshops and trying to build capacity of both researchers as well as ethics committees, and generally physicians and people who are researchers across the board in good governance practices, ethics, as well as in good data practices. But like I mentioned before, there is this intrinsic fear around data, and I think there needs to be probably we need to start teaching this in medical schools and early career like in nursing schools and other health professionals, this thing, saying that data is invaluable in terms of what it can help you with decisions, and having the right perspective about data in the mindset. I think it's more of a mindset issue than structural frameworks, and if we are able to work towards that. So from the Asia Pacific Society's perspective, many countries have been trying to encourage this, and there is a very active ethics forum, bioethics forum that the WHO office kind of anchors, and they have been also doing tremendous capacity building exercise in the region. So there are lots of efforts, Rob, but there could be more that is needed, and really showing the value of what data could lead to, and let's learn from the platform players. See, they are collecting so much of data about us without us knowing that they're actually collecting data.
You mean things like Facebook and others and so forth?
Absolutely.
Okay.
Everyone, all of them.
Interesting. Okay. So, Fiakyong, from your perspective, what sort of training do you think needs to be out there, and what is already available?
This is I'm working with some colleagues on a training, on some training modules. There are some training out there. So there's one module on the ethics of data sharing that's on the DGHN website, and there are also other places, and then there are ad hoc things. But what we would like to do is put them all in one place, and we are currently working towards that, so that there is an electronic version of it as well. Also, hopefully in the next couple of years or so, we will have quite a good critical mass of people who are knowledgeable about data sharing aspects, data management for sharing, metadata curation and all that, to have, so that critical mass can train more people, and then it will be, but of course it takes time. But I think there's a good core group now who is knowledgeable about the various aspects of sharing, so ethics and etc. So I hope that within the next, hopefully soon, we will have a good number of people around the world who can be trainers.
Yeah. Okay. Excellent. Okay. So I've been looking at some of the questions that are coming in through the Q&A, and then, as I said, we have a whole range of questions that were registered, over 180 or so. So I think we're going to try to do them justice. So I don't think we're going to cover them all. One of the sort of recurring themes is we've talked a lot here on this panel around research that's planned and then undertaken, and the consent is in place. So I'm interested now on your thoughts about what the role of consent when we're talking about patients' data and data that's being collected as part of treatment, and how that can be used, how those data can be shared, and what needs to be in place to ensure that those data can be shared, and then we can benefit from those. So I'm not sure who wants to take that first. I think I'm going to look at Uman, and then that gives Gloria and Fiakyong a chance to get their thoughts in order. So particularly with respect to COVID-19, we're talking about patient data. People haven't necessarily given a consent for research, but they are being treated. What needs to be in place for those data to be used?
Thanks, Rob. So this is a question that I had raised when the pandemic was kind of beginning, saying that, see, do we have defined a 7-day period or a 14-day period to call them as recovered, and what about data about them being followed up over a period of time? Okay. Exactly. And yeah. If that was being collected, how are we collecting it? How do we ensure that that data can be pooled, and we know what are the long-term complications or outcomes in people who are having, let's say, a mild episode of COVID. They stay at home, and technically they are cured, or recovered, but are going through things. So if there was mechanisms by which, this is routine data collection, this is not in terms of, so there have been platforms that are trying to now monitor these people at home. They are collecting n number of data points. They may not be in structured electronic health record formats, but if we were able to use that data, if there were mechanisms by which that data, SANS identifiers, is available to be pooled, and then we were able to look at what are the patterns in who are the people who are at risk of developing complications, who are the people who are at risk of long COVID, as they call it. And so there needs to be mechanism. I don't think today we have structured mechanisms by which this kind of data, which is collected either in the healthcare setting or outside the healthcare setting for broad monitoring purposes and other things. So at best, these platforms take a general consent saying, if you're using our platform, the data can be used by us for whatever. But those ones are not really addressed. So I would think that there is plenty of scope of addressing these things. And the one other example that I want to talk about is the observational data, health data that is in routine clinical practice, that is kind of pooled in a common data model. And there are efforts across the globe that utilizes this data for inferences as well as observational database research. So that has been quite successful, because anybody who contributes data into that common data model is able to use that data for research purposes as well as other purposes, such as like inferring on long-term outcomes and complications and things like that.
Okay, so Gloria, from your position on the National Bioethics Committee there in Liberia, what would you be looking for in a data platform that was bringing together some patient data, where those patients hadn't necessarily signed a consent for research on those data? Can that data still be used? I think we've lost Gloria, unfortunately, on that rather good question. So maybe, hopefully, Gloria, you can rejoin us in a minute. I'm going to come to you, Fiat Young. Gloria, are you back?
Not very clear, I think.
No, I'm afraid not. Okay, that's a shame. You're coming a little bit in and out. Unfortunately, so I think she's just dropped off. She may well have to rejoin. We had this problem in rehearsal. I'm going to come to you, Fiat Young. So a similar question, but just something that I know you've got a case study that you can bring up, and that is in situations where we've got a historical data set from some research that was done a number of years ago, but those data are available. How can we use those data when we know the original consent or the original protocol didn't really foresee a secondary use? What sort of things can we now put in place?
Yeah, thank you for that question. Comes up all the time. This is a legacy data set. This was collected prior to us even talking about data sharing. So the example I had in mind is a large malaria study that was conducted between 2005 and 2010 in Africa. It was funded by a charitable UK funder. It was for more than 5,000 children with severe malaria were recruited, and the trial resulted in a change in WHO policy on treatment of malaria. So it was using a drug called artesunate, and now it's registered in many countries where malaria is endemic. So consent was obtained from parents of these children, but not prior broad consent. And it is currently the biggest data set we have on severe malaria in children. So this data set is really valuable, and the data access committee that I coordinate is looking after this data set. So what should we do? There's no prior broad consent. So according to research ethics guidelines that international, it is stated, and I agree, that if a data reuse is minimal risk, and the research question has social value, and you can't reconsent or retrace the participants, then you can consider it. Obviously, minimal risk is a judgment call. Social value is, some of these are judgment calls, right? So these requests came to our data access committee. We looked at the objective. The objective is for malaria research. So it's not looking at other things, for example, psychiatric diseases or anything. It's all malaria research. It's for development of drugs for malaria. So one important thing is that this study will never ever be repeated. It will be unethical to repeat that study. It is impossible to trace the participants. We judged that it was minimal, the committee, judged that it was minimal risk to participants. So malaria is not particularly stigmatizing. And then the committee approved that decision. So it was done in consultation with investigators who were part of the study. And within that data access committee, there is an independent member. So this is how we dealt with it. Obviously, it's a case-by-case basis. This is a malaria data set. It's very special, or quite different from, let's say, a data set with a HIV patient, for example. So I'm not saying it is one rule for all. I'm saying this is how we dealt with it.
And just to go back to the purpose, what did that data reveal? What were the benefits of sharing those data?
So the secondary analysis found that, if you have, I can't remember exactly, but if you have this marker in the blood then the prognosis is such and such for malaria, patients with severe malaria. And then we also have shared the data set with a couple of companies who are developing drugs for malaria. So of course they make money, that's a given, or they will make money, but any new drugs for malaria, it will help malaria patients in the end. So that was a good that we foresee, although we don't really know. But given the balance of risk and benefits, we have given access to the data set to these parties. Of course, we had a data agreement in place. They can only use it for the objective they've stated. They are not allowed to share with other people. They're not allowed to go to Africa and try identify people, things like that. Yeah. So again, we're coming back to this idea that protection is multi-layered. There's more than one element to it. You have to put together a framework. I'm really sorry we seem to have lost Gloria, but one of the things that I've had some experience working with her is putting together the data that was collected in Sierra Leone, Guinea, and West African countries. Sorry, my brain is frying at the moment. During the Ebola outbreak. One of the things that was key in getting the support from the ministries of health in those three countries for the establishment of the data platform was the creation of a shared research agenda. And that research agenda was generated through public consultation, so that the questions that were being answered are the ones which are of most relevance and desire from those countries themselves. So that, I think, is another element here, is that the purpose, as you were saying earlier, around the data, the purpose is clear, and that purpose has a benefit for those people that are supplying those data. It may not be a direct benefit, but there is that connection that can be made. So I'm just looking through the questions again, just to see if there are what areas here that we haven't quite covered in our questions to date. So yeah, I think, I'm going to ask this question again. I know we've kind of touched on it more than once, but I just want to be clear. In situations where there is no consent, what needs to be in place to ensure that those data can still actually be used and benefits can still be realized? I'm going to ask Uman just to give his view on that, and I'll come back to you, Diego. So where there isn't consent, we do have data. What needs to be in place so that we can still get some public health benefit from the utilization of those data?
Sort of like like it was discussed earlier in the case of malaria, it is the intent. What do you really want to do with that data? And is it going to really benefit and bring out something which is a public good, which is in the case of a new drug or a new diagnostic test? Or so primarily it would be intent, and it should be through a proper data governance framework. It's not that somebody writes somebody an email and then say that, oh, here, take this whole Excel sheet of data and you can repurpose it. It should be through a governance framework, which should have properly documented SOPs and why you have, and also clear documentation of why you have done certain things, and get the person who is requesting for that data to agree on the deliverables and sign a contract that covers the purpose for which it is done. So in the context of framework, trust, and transparency, I think we can use data which has been broadly collected, which might not have explicit consent for repurposing, yet has immense value. It's really a call that is both of the broader ethical framework. If you were to sit on the data and it's going to, because that data was not available to further the science on that particular topic, you would have done more harm by protecting the data and sitting on it.
Yeah, no, like that's good. So yeah, no, it's a very good point. So again, what you're really saying is be very, very clear of the purpose, and that purpose has to be justified, and the benefits of the outcome of that research really makes it valid that that research is taking place. Pierre Young, do you want to add anything to that? So that those situations where consent just isn't there, what needs to be in place to enable it?
Actually, I hope that doesn't happen anymore, because I think everyone should get research studies aim to get broad consent from, for all research studies. And then even, for example, if you have things like COVID, right? Every person who has COVID or goes for diagnostic tests, this is the research is expected to help future patients or you as well. So there should be mechanisms in place already. We shouldn't be at a position where we haven't got consent. I think we should try and hopefully this problem will go away soon. Not for legacy data sets, but for studies that are happening now. Certainly for all our protocols and consent forms, we ask for broad consent so that we can use the data for public good to share with other people.
Oh, okay, that's fine. So I'm just looking through the questions here that we've received during the course of the panel. I'm just trying to see ones that we haven't perhaps touched on before. There's a sort of technical level of questions here around privacy and confidentiality. And I'm just wondering, either Viet Yang or Uman, whether you want to talk about how data is protected. How do we try to prevent unwanted hacking or access to data sets?
Oh, Rob, this is interesting. Depending on where you live. If you live in the UK, there's this whole GDPR business. So that's watertight.
Yeah.
So GDPR stands for Data Protection Act. So I can't say for, well, what we do here at Mahidol Oxford is that we have, when we collect data, we collect it on a platform that is really secure. Obviously there's password protection, there's validation. Every user has to be trained and to have their own passwords, no sharing of passwords. Those same things that you would do normally when you handle other sensitive data. And then when it gets to our IT system, there's backup, there's security. So your IT system has to be really good. Security checks and for hacking and all that. So you need the IT security people to help the data management team. So data sharing is multiple aspects. And as I mentioned agreement many times, we have our legal colleagues who help us with the agreement. Yeah, and then we adhere to general data protection regulation, which is very strict. So
Yeah. So it's a combination of a legal framework. So the General Data Protection Regulation is the one that we're familiar with in Europe, but also there is this sort of technical need to have data that's protected behind a firewall and encrypted and those types. Okay.
I mean, simple things like don't use an Excel spreadsheet to collect your data.
Let's not bring up that example. Uman, any additional thoughts on that?
So one thing, Rob, that should be kept in mind, and it needs a little bit of like reimagining with handling data. So you keep your data in such a way that it is it is not worth hacking into. So what I mean to say is that you keep the mechanisms by which you keep the identifiers, everything. First of all, you shouldn't be having identifier. If at all you need to have even a single identifier to the raw data set, you have mechanisms by which they are clearly delinked. So if for example, a hacker comes in and gets this dump of a whole range of hemoglobins, which he or she would not be able to use it if he does not know the age or gender or where it is from. So make sure that the data there is useless from a perspective of a hacker. So that is one way of one way of really securing it.
Yeah.
So we call it like data protection for dummies.
Yeah. No, also, it's absolutely right. Yeah, please go on.
So also when we send data to the requester, we don't email it over. That's really dangerous. We can't do that. So we will use a secure system to transfer data, and then it goes directly to the recipient, and only the intended recipient, can open it. So there are lots of protections in place apart from the usual ones like anonymization. Okay, Rob.
Yeah. No, that's good. No, I think there are quite a lot of technical things that can be put in place, separating the identifiers from the data set, and even not having your data set connected to the internet. Uman, please.
I just want to add one thing, because we are in an age of digital health interventions and mobile apps and all that. They are extremely dangerous in one sense if you don't have proper mechanisms in place, especially if they are directly synchronizing with the servers. So if you lose, for example, a health worker loses a mobile application and you don't have remote data management rights. So the moment it is gone out of your hand, you should be able to lock everything and clean it remotely. So those kind of mechanisms, DRM as they call it, needs to be in place, especially because in many countries, frontline healthcare workers and others carry digital tools that have sensitive data in it. So it's not really about data sharing, but because it's privacy and came up, we need to be extremely careful, because those are easy ways to get into your server and to have a whole bunch of data compromised.
Okay, I think we're losing a bit of the connection somewhere along the line there, but I hope others caught the gist of that. There's another area we've touched on a little bit, but I want to just maybe focus on that for now, and that's around equity in data sharing. So particularly in the areas where we've worked, we're often looking at data that arises in a low resource setting. And so there is this accusation sometimes that data is being exported. It's being collected in one country, but being used and exploited by researchers, perhaps in North America and in Europe. What can be put in place to try and redress that equity imbalance, do you think? So I'm going to start with Phiek Yong and then Uman. So what would you like to see in place?
This is a difficult one. So I think the whole business about training and capacity building shouldn't leave the LMIC researchers out. We should all be trained and build capacity in that area at the same time. Whenever a high-income country institution asks for data set from a low-income country, there should be some element of capacity building. For example, perhaps conduct the secondary analysis together, or interpret the data together, or write the paper together, and then the LMIC researcher should have authorship as well. after having put in the effort as well. So this kind of is, and Rob, if that's not one way, the high income country setting researcher will also understand, what, let's say, collecting data from slums in India or malaria patients in villages in Cambodia is like, because they haven't been here, they don't know the condition. So I think that kind of cross reciprocal capacity building is important. I would advocate for that. Yeah, that's me.
Okay, so I'm really pleased that we have Gloria back online. I'm going to ask the question, then I'm going to ask Uman to answer, then Gloria will come to you. So the question, Gloria, was around equity. And so there is often this case that we see an unequal balance of power, if you like, between those that collect data, typically in low-income countries, and those that are using those data in high-income countries. And I was asking the question around what are the things that need to be in place to ensure that data sharing is a more equitable exercise. So I'm going to ask Uman for his thoughts, and then I'm going to come to you, Gloria.
So, Rob, I think it would first of all deal with right at the beginning of this kind of research projects, outlining the responsibilities upfront. So when it comes to data-related responsibilities, you share it equally. If it is going to be in a low and middle income country setting or a lower resource setting, I identify people. And I think it's also a responsibility of funding agencies to ensure that this kind of an equitable distribution, not only in terms of capacity building, but also in like clearly articulated who will do what. So if and then encourage that, no? So otherwise it will always be the whole question of data export. And one thing that we very clearly practice at where we work is that all data will be held in the country where it is collected, and whoever wants to do research, further analysis, everything will come and sit with our researchers here and work with us and do that. So what happens is that they get a context of how the data was done, all the effort that went into cleaning that data, and also in the process of doing these data workshops, we've seen it work very well. But then this could be a very, very unique niche example. But I think if that could be replicated more by institutions, no? Institutions which are anchoring these kind of research projects insist that a high-income country researchers come sit with the early career researchers, mid-career researchers, and build capacity and do the analysis and the writing up along with them might be one way to prevent a little bit of this export business.
Yeah, that's excellent. Those are really good points. And again, I think it comes back to something that was raised earlier, which is have in place a data plan, a data sharing plan. And one of that will be include capacity building and in that. So Gloria, your thoughts, please. You need to unmute yourself now that you're back with us. And then how do we achieve greater equity in data sharing?
I think I would agree with Omar on the point of making sure that the high income researcher be able to come to the country, to whatever low or middle income country, to be able to support them through capacity and have those whatever data that's being collected be processed right within country. I think I would agree with that, and that's one of the things we have been pushing through in Liberia since the Ebola outbreak, and we have not been successful, if I may, but I think there's a need that we push forward that data collected for other country, for the country remain in the country, and we can encourage international or high-income researchers to come in and be able to work with what is within that country, build capacity, set up the system, and then those information can also be shared. But I think I can agree with Omar on that issue.
Okay, and I think just from my perspective, one of the things that we put into the data access agreements for the Ebola data platform was a requirement for those accessing those data to actually say how will they be building capacity, how will they be working with researchers from West Africa in order to conduct and undertake those analyses. It's not something that we can necessarily enforce. We are nudging people in the right direction to always be thinking about that. Exactly. Yeah, it's about encouragement. I'm just looking at the time. We have about 10 minutes left, and I think we've pretty much covered most of the questions that I can see on the board. I may have missed one or two, and I apologize for that, but I think we've covered the main themes. This is going to be very risky, but I'm just going to do a very small summary, and then I'm going to ask you for your final thoughts. And so I guess one of the things that's come clear in terms of the discussion today, but has been perhaps certainly well documented before, is that in order to enable data sharing, we need to think holistically, and we need to have a comprehensive approach, and we need to make that transparent in a plan. We need a data management plan that really sets out what are our objectives in these data, what is the benefit that's going to come from the sharing and the analysis of those data. And if we do that, and if consent is in place, then we need to think about how we engage and feed back those outcomes to the participants, so that not only do they trust that their data is being used well, they actually see that that trust has come to fruition in terms of benefits. And I think where consent is either less clear or absent, we also need to have in place a governance mechanism that ensures a stewardship of the data, so that it's well looked after, that the benefits are being realized in a way which we can all support. And if we do that, then we can say that we are operating to the best of our abilities within an ethical framework. As we move forward, if we can have more of that in place in advance, then we can probably move faster in an emergency. And also, one of the things that needs to happen is that we need to be sharing good practice and providing better opportunities for training and capacity building, both in the sharing of data, the curation and the cleaning and the management of data sets, but also in the analysis that can be undertaken by researchers themselves. So that I hadn't certainly covered every topic, but I think that's sort of what we were trying to bring up today. And I'm just going to leave, unfortunately, it looks like we've lost Gloria again, and she's coming back hopefully. So I'm going to go to you, Uman, your last few words that you would want people to take away from today's discussion.
Rob, I think the key takeaway for me is that data is a very, very powerful tool. If used appropriately and with the right ethical frameworks in place, it can be transformative, because you need data for informed decisions, and in the absence of which the harm can be significant. So having mechanisms in place, making sure that we share data and have governance mechanisms to ensure that it is done in the right manner is most critical. Okay. Thank you.
Excellent. Kyung, what would you like to leave people with? Your thoughts?
So I imagine a lot of people on this call are researchers. So I would say get data sharing baked into the system, into the institution, so that it is in the culture already, and think about how the secondary analysis, think about the secondary, tertiary, and future analysis, even when you're planning the study. So that's my message.
Yeah, exactly. I mean, have a data management plan and think broadly and through time. Now, Gloria, I can see your icon is there. I'm rather hoping you're still with us. Do you have any last thoughts that you would like to leave the participants with on data sharing? I think, no, yes, Gloria, please, just your last thoughts on what you heard today and what you.
I'm so sorry about the internet connection today. So poor,
this is the reality we work with.
Right. So I think we shouldn't just be the ones just talking about it. There's a need for action, and that action is to set up the requisite framework, the requisite governance structure to be able to share the data. Sharing is good, But how can we make it more ethically justifiable? Is by making sure these policies are in place, the guidelines are in place, that we can ethically use this data and not worry about the aftermath, and then our community can be able to benefit from the outcome of these data, whether informing health policy, clinical data, all of that. So I think it's important that we should not only be talking about it, but also put that into action. Maybe the next time we have this platform, I should be able to say, yes, my country has something, or maybe the Ebola data platform has maybe share out this information in the different countries that people are now applying more to use these existing data. So I think it's important that we begin moving into our different communities, our different research institutions, to be able to create more awareness, be it funding, whatever training capacity, to be able to get this word out to the public. Thank you.
That's great. That's a really good point. And at this point, I would like to say, I think this is what the Global Forum on Bioethics and Research is all about. It is about the sharing of good practices. It is about supporting capacity in terms of understanding data and the benefits of data sharing, but also solving some of these ethical questions so that we can realize the benefits of data sharing without compromising on the harm. So I would recommend those of you that aren't aware to go to the Global Forum on Bioethics and Research, the website. There's a lot of resources there that you may well find useful. I think I apologize if you asked a question and we didn't cover it. I saw there were quite a lot of quite technical questions around genome sequence, which we didn't really get into, but that may well be a topic perhaps more for another one of these webinars. This is incredibly remiss of me. I should have said right at the beginning, this is being recorded and also will be shared on the website once it's been processed. So I hope everybody will find that acceptable. The last thing I need to say is thanks very much to the Global Forum on Bioethics for their support in putting this webinar together. Thank you very much, Gloria, for battling through the internet struggles. I think this is a lesson for all of us in the current world about how we deal with inequities in infrastructure and how we cope with that. Thiek Yong, thank you very much for your inputs, and good to meet with you again online as with you, and John. Thank you very much for your thoughts, and I hope everybody found something useful out of today's session. I certainly found it very interesting and thought-provoking myself. And with that, I'd like to sign off and say have a good day and stay safe, everybody. And I look forward to meeting some of you online and maybe even face-to-face in the future. So thank you and goodbye.
Thank you, everyone. Thank you, Rob.
Thank
Bye.
you. Thank you. Thank you.